New breast cancer screening guidelines may help clarify when women should get mammograms and help identify cancers early when they are more treatable. The U.S. Preventive Services Task Force is recommending women begin mammograms at 40, down from age 50 every other year. Dr. Celine Gounder, CBS News medical contributor and editor-at-large for public health at KFF Health News, joins us now. Good morning. So as we were talking before the cameras were rolling, I think the question people have is, why now? To tell people a year and a half as opposed to the previous guidelines?
So there are a couple of new trends. So we've seen an increase in breast cancer in women at a younger age. So about 10% of breast cancers are in women under the age of 45. In addition, Black women in particular, we're seeing younger ages at diagnosis of breast cancer, more aggressive breast cancer in Black women, and they're 40% more likely to die from breast cancer than white women. So really more aggressive breast cancer screening guidelines we're hoping will help address some of these issues.
So, and of course, you know, early detection, the key here, but the new guidelines, again, every 2 years, some doctors will say, no, you should do it every year. How do you make that decision? Is that, you know, your doctor's gonna look at your background and figure out if you're more susceptible, then you need to fall more in line with the every year?
This is really based on the evidence available to the U.S. Preventive Services Task Force right now. This is one area of controversy or where there's a lack of adequate information. Two others are what to do for women who have dense breasts, how best to screen them, and for women over the age of 75, whether they need to continue screening.
As far as these new recommendations, how do they affect insurance coverage?
Women already had insurance coverage starting at age 40 every year for breast cancer screening.
Okay.
These guidelines are one factor in determining breast cancer screening, but they're not the only one.
All right. Well, very, very important information, as I got my first mammogram this year. And they even asked if I wanted the AI to help detect anything extra, which I thought was interesting as well. Dr. Gounder, thank you again.